History of Healthy Introduction of Healthy System and the Healthy Information System 2021. Overview of Healthy System and the Healthy Information System. Outline. Session 1. Overview of Health System and the Healthy Information System. Module Objective. At the end of the training, the participants will define concepts and the functions of healthy system and healthy information system HIS. Describe the different data sources of healthy information system or HIS. Define the concepts and the definition of HMIS, healthy management information system. B. Familiarized with restrict healthy information system 2 or DHIS2 basics. Be familiar with DHIS2 different features and functionalities. Be familiar with data analysis and visualization features of DHIS2 for decision support. For decision support, DS. Healthy system. A healthy system is the sum total of all organizations, people, resources, and all activities whose primary purpose is to promote healthy, to restore or maintain healthy, to protect or improve healthy. The major objectives of healthy systems are improving the health of the population they serve, providing financial protection against the costs of ill health or risk protection, sharing risk and providing financial protection, fairness in financial contribution, improving health system confidence. WHO's health system building blocks. Health system functions. Health system performance. Impact. Leadership and governance. Healthy workforce. Healthy information systems. Medical products, vaccines, and technologies. Human healthy financing. Criteria, access, governance, coverage. The criteria is access, coverage, emergence, equity, quality, safety, sustainability. The impact is responsiveness, risk protection, improved health, communities and patients. Health information system, HIS. HIS or Health Information Systems refers to any system that captures, stores, manages, or transmits information related to the health of individuals or the activities of organizations, which will improve healthcare management decisions at all levels of the health system. Product availability and the use of reliable and timely information on the three domains of health. These are health determinants, health systems performance, and health status. Health information data sources. Census, vital registration, population-based survey, administrative records, service records, individual records, census, vital registration. Population-based surveys are population-based. Administrative records, service records, individual records are institution-based. Health Management Information System or HMIS. HMIS or Health Management Information System is the routine collection, aggregation, analysis, presentation, and utilization of health and health-related data for evidence-based decisions by health workers, managers, policymakers, and others. Purposes of HMIS: making accurate, timely, and complete data to support decision making at each level of the health system available. Strengthening the use of locally generated data for evidence-based decision making. Health Management Information System examples: patient claimed data, demographic information, history of present illness, previous medical history, laboratory diagnostic result, treatment or service provided, health facility data, number of deliveries attended, number of human resource available, morbidity and mortality by cases, administrative level, service coverage, ANC for delivery, HCT testing rate, pharmaceuticals or essential drug availability, service quality, equity, attrition rate, disease burden or prevalence or incidence. Question and answers. What do you understand by the following data-related concepts? 0. Variable, measurement, data, information, indicator. Health management information system indicator by category. C1. Improve access to health service. In the bracket 97. C2. Community ownership. In brackets 3. F1. Resource mobilization and utilization. In bracket 4. F2. Health insurance. In brackets 3. P1. Quality of health services. In bracket number 8. P2. Pharmaceutical supply and services. In bracket number 4. P3. Evidence-based decision making. In the bracket number 3. CB1. Health infrastructure. In the bracket number 4. CB2. Human capital and leadership. In the bracket number 4. CB3. Regulatory system. In the bracket 1. Total HMIS indicators in 2021 is 131. Health Management Information System data recording and collection tools. Facility-based, individual medical records, in the bracket 10 plus. Registers, in the bracket 36 plus. Tally sheets, in the bracket 14 or 14. Reporting formats. Community-based, agrarian CHIC, Community Health Information System, pastoralists CHIs or Community Health Information System, urban CHIs, and ECHIs, family folder, integrated RMNCH card, patient card, registers, tally sheets, reporting formats, NCOD. It is the national standard system of defining, monitoring, and reporting healthy conditions and their outcomes. It is also fully mapped to the ICD-10, NCOD, National Code have 22 chapters and broken down to 216 disease group. Category for health post, level used for health post. Number of disease list 45. Mini edition prime level used. Under category mini edition level used primary level health care. Number of disease list is 616 or 616. Under category compact edition under level used secondary level. Under number of disease list 1848. Under category extended edition under level used territory level or reference. Number of disease list 2055. Thank you.